Urinary catheterization. Researched and compiled by Rebecca Lead. Urinary catheterization is the insertion of a specially designed tube into the bladder using an aseptic technique. This can be for the purpose of draining urine, the removal of clots or debris, and the installation of medication. Mrs. Shah is oliguric. Her bloods have shown renal failure. This is an indication that catheterization may be appropriate. Catheterization of patients such as Mrs. Shah, who are in acute renal failure, or those at risk of developing acute renal failure, allows for accurate measurement of urine output and enables staff to determine the effectiveness of any treatment given. Due to the risks of trauma, infection, blockage, and mortality, indwelling urinary catheterization should not be undertaken unless clinically necessary. Alarmingly, more than 50% of patients catheterized are deemed to be done so inappropriately or unnecessarily. The use of an indwelling urinary catheter is estimated to be the most significant risk factor for the development of a UTI, or urinary tract infection. Now that it has been deemed clinically necessary to catheterize Mrs. Shah, we must gain her informed consent. Whilst explaining the procedure to Mrs. Shah, you must ensure that the patient's privacy and dignity are maintained at all times. Hands should now be washed using the 7-step technique in the patient's area if at all possible. Washing your hands in another patient's cubicle is unadvised. It is worth mentioning that the A&E in which we filmed has since been put under special measures due to concerns over patient safety and bad practice.
Nurse!
All of the relevant equipment should be gathered upon a sterile dressings trolley, which is being cleaned in line with your trust's protocol. The reverse of the catheter pack itself will list the expiry date, the size, and the amount of sterile water that will be required to inflate the balloon. The area around the urethral opening must be fully cleaned in order to prevent the introduction of an infection. You should clean the area in a front-to-back motion. And of course it goes without saying that at this point the patient's privacy and dignity are still maintained to the highest degree. The use of a catheter gel, such as Instilla gel, will help pass the catheter. Instilla gel contains a mild local anesthetic. As well as being used on the end of the catheter tip itself, it will be put into the patient's urethra and left for several minutes for the gel to seep in and take effect. Now is an appropriate time to re-wash your hands. Fresh, sterile gloves should now be donned from the dressings pack. Exposing just the tip of the catheter from its protective plastic sheath, it is now time to locate the urethral opening via the relevant landmarks and pass the catheter. The catheter should now be steadily advanced until it reaches the bladder. You should get confirmation of entering the bladder when urine is passed through the catheter. Once catheter placement has been confirmed, it should be advanced very slightly further into the bladder to ensure the balloon is clear. The balloon should then be inflated with the relevant amount of sterile water. Once the balloon is correctly inflated, the catheter should be slightly withdrawn until resistance is felt. An appropriately sized and graded catheter bag should now be connected to the tube. There are many different types of bag, and trust policy will likely dictate which to use. You can also get customized ones. After completing the procedure, you must make sure that the patient is comfortable, calm, and that their privacy and dignity is being upheld.